Hi and welcome to today's video. I'm Mary Felling. I'm a physical therapist with over 30 years experience, and in the last 25 years I've specialized in an area called the John Barnes Myofascial Release approach. Today's video is for the lower leg, so the calf and the front of the leg. These exercises I'm going to be showing you are two really good treatment techniques for you if you're a runner, if you work out of the gym a lot, if you have to crouch and bend down on your knees and get back up out of a crouch position a lot. This will be very helpful for you. It really only takes one tool, and that is the TheraCane. There is a link to getting a TheraCane in the description below. The only reason you'd want to use the TheraCane though is for those of you who might be very arthritic in your fingers, or right now have some kind of a strain or problem going on with your wrist and your hand. Other than that, you don't really need a TheraCane, but I'll show both techniques. So this first technique I'm going to show you is for the front of the leg, for the outside of front of the leg. Cross, and you can see I'm just in a regular office chair, so you don't have to be anywhere fancy. You can be on a couch or the edge of the bed, doesn't matter. And you're going to take your hands, your fingers are going to be curled like this, and you're going to find that shin bone, and then you're just going to go past that shin bone where it's soft, and that's the area we're working in, anywhere from the top of the knee all the way down to the front of your ankle. And you just want to squish in there a little bit, kind of like a spider moving very slowly. And you can see I'm compressing, I'm keeping my fingers like this, so I have a lot of compression. And you're looking for a tight area or a tender area. You want to go all the way back to the side here too, so it takes a moment or two to really find your tender spot. I've got a really tender spot right there, and I already feel it radiating to the back of my thigh, so I'm going to kind of memorize that spot. Oh, so mine are much further around to the side of the leg instead of in the front here. This is generally, if you're a runner, this is where shin splints happen. So go ahead and pause the video until you find your spot, and when you find your spot, come on back and we'll start the clock. Now, for those of you who are having problems with your hands for whatever reason, your pain or stiffness, you can use your TheraCane instead. And a TheraCane, I've got the link in the description below. You would use this end of the hook end, and you just find your spot. Now, as you go along, you'd find the spot, and then you just press. Just this, me pulling this back is enough pressure for me. I can feel that very, very smartly on the side of my leg. And I'm not pressing in bone, this is soft tissue. Shin bone is up here. I'm on soft tissue. It's very tender there. But if you don't need a TheraCane, just continue with your hands. But I just wanted to show that for those of you who might have problems with your hands right now, arthritis or just discomfort and stiffness. So we've got the clock started. And I'm on a spot, what I've got located is very bruised feeling, but I have looked, there's no bruise there, so I know it's a myofascial restriction. Never do any soft tissue work directly over a bruise. You need to let that start healing. So like I was saying earlier, if you're a runner, this is an excellent treatment technique for you. This is really good too if you're a golfer. Why would that be? Because when you swing in the golf, you have to have rotation from the hip down through the leg and into the ankle. If you're stiff anywhere along, then you can jar that joint that has the last amount of rotation or flexibility in it. So working through here helps improve and maintain flexibility at the ankle and the knee. Same with you tennis players. This is really good for you. You do a lot of start and stops. That requires a lot of ankle stability. It requires a lot of strength for all the ankle stabilizing muscles. And this is what we're on right now, is one of them. So you might get in there and finding you're very, very tender. I know you see me moving around. I'm just on my own trying to find where else am I tender, but you stay on the same spot. Remember, it's a minimum of 5 minutes of mechanical energy, which we're using compression for mechanical energy to start that bioelectric flow, get that piezoelectric effect moving through the fascia to help start softening those areas that are tight, tense, bound down, dehydrated, And at 5 minutes, it starts rehydrating. You get elasticity coming back. Anything before 5 minutes, if you feel some softening, some relaxing, that's the muscle component. The elastin component is releasing, and that's good too. But we need to get to the fascia, because the form of a muscle is governed by the fascia. How tight or how relaxed it is influenced by the fascia. So if you can influence the fascia to be released, you can influence the muscle to be released and relaxed and elasticized. Is that a word? We'll make it a word. While you're there, you want to pay attention to any radiating symptoms. Maybe you feel it going up your leg, maybe you feel it coming behind your calf or into your foot. In myofascial release therapy, I always instruct my patients that if you feel it going somewhere else, make a mental note, because they would want to work on those other areas after they finish what their current treatment area is. So we're waiting for that 5 minutes. You can do a nice visualization technique at this point. You can close your eyes and see inside your body where you're working and get a 3D image of what that area of pain or tightness looks like, or discomfort. Maybe it feels numb. And when you get that image, see it, whether it's, a pile of goo or barbed wire all gnarled together, see it softening, relaxing, and becoming fluid, and then see it moving out towards the surface of the skin. See an opening in the surface of the skin for that to move through. And then when you've gotten as much out as possible, close the opening behind it and bring yourself back to where you're visualizing where that pain and discomfort is. And how does it feel now? And if you need to move more out of that area, just repeat the same visual you just did. Check yourself, make sure you're nice and relaxed. My shoulders were up around my ears. Relax the rest of your body. Breathe into the area of pain. You can even close your mind. Another good visualization technique is to see a tube like a straw going from your mouth down to the area of pain, and just breathe air and breathe your breath into that area of pain to help soften it and relieve it. That's another great visualization. All right, so we're coming to the end of our 5 minutes. You're welcome to stay there. For the rest of you, look for another spot along this side. So find your shin bone, go to the left, or to the right, go to the outside of the shin bone, and all the way to this side of your leg to find a tight or tender spot. And then go for that second spot. We've completed that 5 minutes, so very slowly you can come out of the position. And just a reminder, we've found one spot, we've worked there. If you would like to work on a second spot for an additional 5 minutes or more, you're welcome to go again, take your fingers, crawl, anywhere from the lower part of your shin all the way up to below your knee. Find another tender, hot, or hard area, and you can do another 5 minutes there. If you feel really good about just the one spot you worked on, then just stay tuned and we'll take you into the second treatment technique for this video. This next technique is for the calf, back of your lower leg. And specifically, we're going to do a technique that gets the lower part of the calf, the tendon, into the calcaneus, this bone here. And this is really important, especially if you have plantar fasciitis. Many times therapists will work just on the foot and then they'll do a regular calf stretch. But if we can work on the Achilles tendon back here, its attachment sometimes gets so tight and overworked where they come across the side of the calcaneus, around into the inside of the calcaneus. A lot of people, a lot of dancers, golfers, tennis players will feel pain there because it's really more, the doctor might call it, the professional might call it a plantar fasciitis, and it's true. It does connect into the plantar fasciitis, but its origins may be more from the Achilles tendon. So that's what this technique is for. So you're going to get in any chair. Again, I'm just in an office chair. Your feet are flat on the floor. You're going to to pull either foot back until the heel begins to come up off of the floor, and at that point you stop. And then press the heel down. You might even need to push your hands on your top of your thigh to get the pressure on. And in that position, you should start feeling a pull or elongation back in the lower part of your calf, top of the heel. And that's what we're going for. So in this position, we're going to start the clock. Make sure your heel is behind your toes. So I'm not like this. I'm not like this. I've got everything lined up, my knee, my foot, my knee is over my toe, my knee is over my ankle, and I've brought my foot back, and I'm not bringing my toes out to the side or into the other side. We've got that timer going. For some of you, you might get into this and say, yeah, I can keep my heel down, but I don't feel a stretch in the back. In that case, we're going to go and do the calf release technique. For the rest of you who feel this, you're just going to stay in this position, and as long as you're breathing naturally, as long as you can stay relaxed, that's good. Even if there's pain, you're not injuring yourself. You found a myofascial restriction, and that's what's being released. So keep your back nice and tall. You know, none of this stuff. None of this stuff. Spine is nice and tall all the way to the back of your head. And as you're here, you might feel some burning. That's usually a sign a restriction has been around a long time. It's a sign you do need this. But if it becomes too painful, then back off a little. If you find yourself holding your breath or tensing somewhere because of the pain, take some of the slack off, or give it a little more slack rather, so that you can relax in the position. Keep your back straight. Doesn't matter if you're on a couch, the edge of your bed, on an office chair, it doesn't matter. What matters is you've got the heel down on the floor, and it's behind your toes. It's not this way. You're not like this. There's a direct line from your knee, your toes, and your heel are all in the same direction. So it's not like that or like that. All right, so in this position, you will be doing this on both sides. Even if you have something just on one side, it's always great to be able to treat yourself and do these techniques bilaterally, i.e. both sides, preventative-wise. And this is something you'll do for 14 days in a row, and then something you can do prior to running or dancing or playing tennis, whatever your activity is, so that you prevent injury to the calf, to the Achilles tendon and the plantar fascias while you're working out. And then you would also do it following that tennis match or that run that you're going on or the workout that you have in the gym to help alleviate any tension patterns that were started during that time that you were at the gym or playing tennis or what have you. So it's a good preventative thing too, besides being a healing technique, to remove and resolve fascial restrictions through your Achilles tendon and down into the plantar fascia part of your foot. Now some of you, if you hold on, for those of you who are saying, well, I really don't feel it, and actually I just feel some pain in the front of my ankle, we'll be doing a calf stretch because that's probably more of what you need. And if that's you, you'll see how we'll get that done, the difference that makes for you. So everybody needs their calves or their Achilles tendon to get some attention. We all need to give some attention to our Achilles and our calf. And again, check yourself. Shoulders are relaxed. Spine is nice and tall and straight. You can be forward if you lean and hinge from the hip, but you don't want to round your back. You can have a bigger stride if you want, if that helps you balance better in your sit position. And for those of you who are feeling pain or it's just really stiff, close your eyes and do that visualization. Just see a straw going from your mouth through your body into that part of your heel or your lower calf where you feel tension, burning, tightness, whatever your sensation you have. And just breathe your breath very gently. You're not blowing hard. It's not a breath technique, it's just a visualization technique. And as you breathe in, see it relax as that breath comes across the tender, tight area. In your mind's eye, see it softening and releasing. See a good blood flow, see some healthy pink and red blood vessels, just vascularizing the whole area and providing good blood flow. We're at the end of our 5 minutes, and you very slowly just come out, rock your body back, bring your foot forward, because that gets the joint of the ankle, besides working on our lower calf. So just do a couple of ankle circles left and right. You might pull your toes up and then curl them down a few times, just to help that ankle feel a little bit better after that. And again, 14 days in a row, and especially following any activity you're doing and before you perform that activity. Here we are at the stairs. This is what I was talking about earlier when we were doing the Achilles tendon release. And if you were in the position for the Achilles tendon release and you weren't feeling anything except maybe some pain at the front of the ankle, then you would want to go to a traditional calf stretch. And same thing, 5 minutes in the position. And the easiest way, at least this is how I do it, is to get on a stair, make the ball of your foot right at the edge of this stair. You can do both feet at the same time. And just slowly let your ankles come down below the step and then relax here for 5 minutes. You can also, if you have one calf that is particularly tight and you want to focus on that, just put one foot up on the next step, and it's the foot on the lower step, that's the calf that you're stretching. You just hang out there 5 minutes and you'll feel that great calf stretch. So traditional calf stretch, and or for those of you who really can't feel much on the lower tendon, the lower calf, the Achilles tendon stretch that we just did. Thanks for watching again, and I'll see you in our next video.